This is a technique focusing on posterior neck pain for patients who are suffering from general neck pain or whiplash associated disorders. The first piece will be a 10 cm patch which will be placed between both medial borders of the scapula, just covering C7-T1. We will then take two other patches and apply them to both sides of the paravertebral gutter from the base of the neck to just below where the 10 cm patch ends. With the patient seated, ask them to take their neck into pain-free flexion, and from here you will see the most prominent spinous process, C7-T1. We will then take the 10 cm patch and anchor off just on the medial border and apply with no tension towards the opposite scapula, just covering C7-T1, ensuring anchor is placed down without any tension. We will then take our first eyepiece and apply this just above the 10 cm piece on the base of the neck, being careful not to encroach on the hairline. Remove the backing tape and apply with mild tension down the spine and anchor off, ensuring the anchor is placed off beneath the tape. And then we will repeat this for the opposite side. Remove the backing tape and apply with mild pressure. Again, anchor off beneath the 10 cm patch. Rub the tape to apply a bit of heat for good adhesion.